Moderation and modification of activity are important for reducing the symptoms of arthritis. For example, you may need to avoid stairs if climbing them causes serious discomfort. Your doctor may recommend that you stop or cut down on high-impact activities, such as running or sports that involve twisting and jumping. Because weight loss and increased muscle strength may reduce painful symptoms, staying active is important. Walking, cycling, and swimming are a few of the low-impact exercises that can help you manage your weight and improve your strength. In some cases, guidance from a physical therapist is helpful. Many people benefit from the use of heat or ice, applied in a safe manner and taking care to avoid skin damage. Individual preference for heat or ice varies. Many people also benefit from compression, such as that provided by a neoprene knee sleeve or elastic bandage around the knee. In addition, assistive devices such as braces, canes, and walkers help to support the knee and also improve safety. Medication can also be of benefit. Over-the-counter medications, that is, medications you don't need a prescription for, can reduce pain and swelling. These include acetaminophen, ibuprofen, or naproxen. If over-the-counter medication is not effective in controlling discomfort, your doctor may recommend prescription, non-steroidal medications. In addition, certain food supplements have been reported to improve arthritis pain. Be sure to talk with your doctor about all over-the-counter medications or supplements that you take. Injections may also be used to treat arthritis pain. Occasionally, cortisone is injected into the arthritic knee to help decrease painful inflammation. This measure, which can be employed 2 to 3 times a year, is temporary. The degree of relief provided and how long the effect lasts are both unpredictable. In addition to cortisone, a natural lubricating substance, hyaluronic acid, may be injected into the knee. This treatment generally involves a series of injections which diminishes pain for a variable amount of time. The effect may last several months. In general, this treatment can be repeated twice a year. When non-surgical methods are no longer effective at relieving pain, surgery may be an option. Some patients with less severe arthritis may benefit from a procedure called an osteotomy. Osteotomies are most helpful when only one area of the knee is damaged. In this operation, one of the long bones in the lower leg is cut to shift the weight off of the arthritic area of the knee. Younger, more active patients may be good candidates for osteotomy. This procedure may relieve pain for several years. However, some patients will later face knee joint replacement. Arthroscopy may be recommended for patients with mild arthritic changes in the knee in conjunction with meniscal cartilage tears. This procedure is most effective in someone with symptoms of catching and locking of the knee caused by the meniscal tears. Arthroscopy is unpredictable for relieving arthritis pain and is generally not done for pain relief alone. Osteotomy and arthroscopy are designed to allow a person to live with their arthritic natural knee. If these treatment options become ineffective, the next step may be consideration of knee joint replacement.